Hello, and welcome to the Quality Insights Practice Module Overview on Social Determinants of Health. My name is Cindy Biederman, and I'm a Practice Transformation Specialist with Quality Insights. Today, we will present a high-level overview of evidence-based information relating to cardiovascular health and blood pressure management. This work is part of Quality Insights' ongoing efforts in providing Pennsylvania medical practices with information to assist with improving the prevention and management of hypertension, diabetes, and stroke, and it's designed to promote and supplement your current quality improvement efforts. This live activity and enduring material has been planned and implemented in accordance with the accreditation requirements and policies of the Accreditation Council for Continuing Medical Education through the joint providership of the Pennsylvania Medical Society and Quality Insights. The Pennsylvania Medical Society is accredited by the ACCME to provide continuing medical education for physicians. The Pennsylvania Medical Society designates this live activity and enduring material for a maximum of 1 AMA PRA Category 1 credit. Physicians should claim only the credit commensurate with the extent of their participation in the activity. This course is approved for 1 hour of continuing education for nursing. Quality Insights is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Center's Commission on Accreditation. All of the content we'll be reviewing today is only a summary of a printable resource produced by Quality Insights in spring 2021. You can find the downloadable PDF version of this module by visiting the Quality Insights website, linked here and at the end of the presentation. Please keep in mind that the various resources in the module are not endorsed by Quality Insights, and that guidelines and recommendations referenced are to be used along with clinician judgment and based on individual patients' unique needs and circumstances. Should you have questions related to the content, please contact your local Quality Insights Practice Transformation Specialist. The Quality Insights 2021 Social Determinants of Health, or SDOH module, provides a framework for identifying social needs in the clinical setting and how the healthcare team can work together to assess and address social determinants in Pennsylvania communities. This update includes new statistics and expanded content for assessing and screening for social needs, including utilization of the Prepare Toolkit, implementing a standardized closed-loop workflow that addresses SDOH, and getting started with connecting patients to local assistance resources. This module can be used by clinic leadership to determine next steps for workflow modification and alignment with resources available in your region. In 2018, the most common cause of death in Pennsylvania was cardiovascular disease, and 47% of residents lived with one or more chronic diseases. Tobacco use, excessive alcohol use, physical inactivity, and poor nutrition are major risk behaviors for these chronic conditions. Other important social and environmental aspects that vary throughout the state and seriously affect the health of Pennsylvanians include racial disparities, poverty, illiteracy, unavailability or unaffordability of fresh food, and lack of access to safe places for play and exercise. The 2020 Pennsylvania Health Assessment confirms health disparities persist throughout Pennsylvania and the nation, and COVID-19 has underscored and magnified this reality. A few examples of disparities from the report include Black Pennsylvanians had higher rates of death due to heart diseases, cancers, cerebrovascular diseases, diabetes, infectious and parasitic diseases, homicide, kidney diseases, and septicemia. High rates of homelessness and lack of health literacy. While the COVID-19 pandemic has increasingly brought social determinants of health disparities, and health inequities into focus, we know these challenges and opportunities long predated this crisis. This practice module aims to equip health professionals with the practical tools needed to identify and address social needs as part of their regular workflow and provide all Pennsylvanians with equal opportunity to make good choices that lead to good health. According to the Surgeon General's Call to Action to Control Hypertension, released in October 2020, certain groups of people have disproportionately high rates of hypertension and its related health consequences. Prevalence is higher among older adults and is also notably higher among certain racial and ethnic groups, especially non-Hispanic Blacks. Although several modifiable and non-modifiable factors are regularly recognized as contributing to hypertension, a third arm of risk, identified as social determinants of health, should be prioritized. Psychosocial and socioeconomic stressors, such as low socioeconomic status, depression, job stress, financial stress, and neighborhood poverty level, also contribute to the risk of hypertension. Self-measured blood pressure monitoring is an evidence-based intervention shown to improve rates of blood pressure control. Quality Insights, in partnership with the Pennsylvania Department of Health, can supply medical practices with up to 5 automated home blood pressure monitors that can be loaned to patients. This is a great program for patients who do not currently own or can't afford to purchase a blood pressure monitor, are newly diagnosed with hypertension, or are experiencing a change in blood pressure medication. If your practice is interested in participating in the Blood Pressure Monitor Loaner Program, talk to your local Quality Insights Practice Transformation Specialist for more information. Social determinants of health are increasingly being recognized for their relationship to the soaring incidence of type 2 diabetes in the United States, as well as opportunities for the healthcare community to counter it. The Association of Diabetes Care and Education Specialists recommends the following strategies for understanding socioeconomic factors and promoting improved outcomes for diabetes patients. Provide extra resources that can help patients face difficult situations, including referrals to mental health services and other social services such as food pantries. If you serve multilingual populations, provide language-appropriate information. Use motivational interviewing techniques to address barriers and individualize care. Offer other resources and referrals, such as to healthy cooking classes, support groups, smoking cessation programs, and the National Diabetes Prevention Program. Several screening instruments are available to aid physicians in identifying social determinants of health in a primary care setting. The National Association of Community Health Centers Protocol for Responding to and Assessing Patients' Assets, Risks, and Experience tool, or PREPARE, is both a standardized patient social risk assessment tool consisting of a set of national core measures, as well as a process for addressing the social determinants at both the patient and population levels. By using PREPARE, providers can better target clinical and non-clinical care, often in partnership with other community-based organizations, to drive care transformation, delivery system integration, as well as improved health and cost reductions. A few additional benefits include EHR integration and abundant resources and helps for implementation. The American Academy of Family Physicians offers the social needs screening tool through the Everyone Project, which can be self-administered or administered by clinical or non-clinical staff. It screens for 5 core health-related social needs, which include housing, food, transportation, utilities, and personal safety, using validated screening questions, as well as the additional needs of employment, education, childcare, and financial strain. The Everyone Project Toolkit offers a variety of helpful strategies for use in the clinical setting to improve patients' health and address social determinants of health. The CMS 10-question health-related social needs screening tool is meant to be self-administered. The tool can help providers find out patients' needs in 5 core domains that community services can help with, including housing instability, food insecurity, transportation problems, utility needs, and interpersonal safety. A tool available to capture data on the social needs of a population is the Icd-10-Cm codes included in categories Z55 to Z65, the Z codes, which identify non-medical factors that may influence a patient's health status. Existing Z codes identify issues related to a patient's socioeconomic situation including education and literacy, employment, housing, lack of adequate food or water, or occupational exposures to risk factors. Using Z codes allows clinics and hospitals to better track patient needs and identify solutions to improve the health of their communities. Clinical leaders can prioritize the importance of documenting and coding patient social needs and allow coders extra time to integrate coding for social determinants of health into their processes. When implementing any type of social determinants of health intervention, it's important to engage the practice team. Many of the assessment tools provide suggestions for attaining buy-in from care teams and developing roles and workflows. Quality Insights can offer assistance specific to your practice, such as the suggestions shown here for care team roles and actions for implementing primary prevention of cardiovascular disease. Contact your local practice transformation specialist for more information. Once patients' needs have been assessed, the next important step is identifying available community partners for coordinating appropriate referrals. These links and more are provided in the learning module to assist your practice in developing resources in your region. You will also wish to refer to the many suggested workflow modifications in the module, including ideas for optimizing your EHR, protocols, practice in clinical, and patient education. I hope today's brief overview of the Social Determinants of Health learning module has been helpful and that you'll be able to use the information in your practice. We invite you to visit the Quality Insights website to download and review all of the available information for this module. Quality Insights also provides a free e-bulletin that features regular updates and resources for cholesterol management, hypertension, prediabetes, and diabetes. Finally, if you have questions or need assistance with implementing quality improvement activities in your practice, a Quality Insights Practice Transformation Specialist is here to help. Please reach out to us at any time. Again, thank you very much for taking time to review today's recording. Have a great day.